And you are live.
Hey guys, it's Dr. Emer, and we are in West Hollywood. Late night tonight. It's been late nights lately because a lot of people have a little bit more downtime lately and they're wanting to do some of their laser treatments. We are doing one of our favorite treatments for deep acne scarring and overall facial rejuvenation called CO2 laser. This one though is very special. It's actually used by the government for burns and scars. I told you guys last year, Rosa, I knew you were going to do that. I knew it. I love that. That was so funny. It's okay. It's actually used by the government for burns and scar patients. This is called the luminous ultra pulse. I was one of the first doctors to actually do clinical trials with this years and years ago. And it's still actually the most powerful laser on the market, going up to 4 millimeters in depth with scar FX. Right now we're going to that 2 to 3 millimeter depth using the deep FX. And you can see, almost looks like nothing's happening, you guys.
Does this affect your facial hair?
Not at all, but if you look, I want you to come really close. Look how close this is. It's so swollen because all these little dots that are being exposed, 0.12 millimeters, are going to scab up, crust and scab, and form new collagen. It's literally going to retexturize his skin. I mean, look, you guys, he's young, he's a very beautiful, good-looking guy, but he's got some textural irregularities, a little bit of scars, a little irregular texture. So what we're planning to do is do this every year or two to just rejuvenate a lot of his scars and overall just make his skin look a lot better. You can see like some of these deeper scars need the deeper laser to get improvement.
So I have acne scarring that I had for years. Does this help it?
This would totally help it. Bring your head straight for me now.
Does this affect the facial hair?
This does not affect facial hair at all, guys. That's why we can do it. Otherwise, we wouldn't be doing it on a young guy. So if you see, you know, he's doing really well because we have nerve blocks, and these are very small channels going really deep in his skin. But look how cool, I mean, you can see all the swelling. We're focusing the deep part on his main scarring areas. And a lot of people have, you can see here, take a look, that irregular texture right there. So we want to build the collagen in there.
Does this hurt?
It. How does it feel? Tell everybody, how does it feel?
Me?
Yeah. It's hard for him to talk, he's got nerve blocks.
I can smell burnt hair and it hurts, but last time I didn't have numbing and this feels
a lot better.
Like a 4.5 out of 10 on the pain scale. Last time it was like a 9 out of 10.
But so yeah, you guys, that's the thing is, I like to do nerve blocks. I've done this for 13 to 14 years. If you don't, it's very intolerable. So it's one of those things where I just kind of force people to do it. You guys can see now, take a look at the one side, all the different marks. Now what I say is it takes about 4 minutes to really see all the marks. So I'm watching them kind of swell up so that I can kind of what I call fill in the blank.
Does it cause hyperpigmentation for darker skin?
Yes, this can cause hyperpigmentation in dark skin. He's very lucky because if he wants to stay young and beautiful, he can do that with any laser and do really super strong. You turn all the way to the right now, lift your head, perfect. So I want you guys to see, look at the irregular texture. He doesn't have a lot, but like you can see here, here, right here. The goal of this laser specifically is to go really deep and stimulate collagen to lift the scars. The second pass we're going to do is going to cause him to peel. And that helps the surface, him just getting rid of sun damage and softening his skin. So, what was your goal? Tell everybody, what was your goal with the scarring?
To get rid of our acne, pocket scars, to tighten, to help my large pores, fine lines, wrinkles.
And he knows, he's done his research, like he is super smart. And so he was like, look, I want to do a big treatment, get a big improvement, and then after that I'll maintain with a treatment plan. So our idea for him would be every 3 months after this to do a Fraxel, maybe microneedle every month, do some microneedling PRP, maybe Fractora, which is a needling treatment with heat. And it will go from there. We'll build upon this, but this will be, you know, about a 7 days, looking a little crazy. I'm not going to do as bloody on him as he's had before, because I don't think he needs the surface of his skin to be completely removed, which is what he had last time. He needs more deeper heating, which is what I'm doing right now. That's why you guys can see, if you look really close, when I pulse these, look, you can see all the little dots.
Dr. Caroline from TikTok says, clap, clap, clap.
Thanks, guys. So we are going to follow him every day. Because I want people to see, you know, what it's like. It's very important. You know, I treat a lot of scars and a lot of burns. And it's very important you go to somebody who knows what they're doing when they do this treatment, because you don't want to get damaged. You don't want to damage your skin.
What's that tube that we see coming out?
This one or this one?
That tube right there.
This is suctioning all the dead skin cells right in here, into there. And so is this one right here. Somehow, and something else gets sucked in there every time we do this treatment, you guys. Just
No,
so you know.
now what did you mean? This was used to be used in the military.
So the military uses this on people that have been burned or had wounds or scars. This is the go-to laser for the military. It's super expensive. It's the Ferrari of lasers.
Zoo Glam is excited for her procedure.
Who?
Zule Glam.
Can't wait till you come in. When are we seeing you? So he's doing great. So this is really deep FX, guys. I think we're going to finish up and we'll come back and we're going to do active. The superficial part. Stay tuned.
We got Sexy Alice Rojo says, hello, Dr. Emer, Florida, Miami. I live in Brickell City. #1 fan.
We love you in Miami. I wish we could go to Miami.
Miami.
See, we haven't been there in a while. Soon to be either Boca or Fort Lauderdale.
Wish you had a clinic in Toronto.
I know. A lot of our patients from Toronto come to see us. We love our Canadians.
Doctor, me and my coworker are trying to go in.
What?
Doctor, me and my coworker are trying to go in.
So come in, DM us your name, email, and phone, and we will get back to you. We have been super busy. Social team's working hard, guys. He's gonna do so great.
But what is the social team really excited about? What's new? What new stuff do we have?
Well, we have Emerald Skin, you guys, and the cool thing about Emerald Skin, which is that my new skincare line that's launching on July 20th, is we're gonna donate proceeds to charity, to both LGBTQ+ and BLM groups, and we're gonna have an announcement soon. Once we sign, we're gonna collab with a very large organization that's gonna support a lot of youth. So definitely go to mrscosmetics.com and support our brand because it supports causes. Pre-order your products so that we can make money for charity.
So if I buy my vitamin C and say like an Airify peel, you're gonna use that money for charity?
Not all of it, a small portion of it, but yes.
That's
we're
nice.
gonna give it to charity. I had to spend all of my savings to make this because I believe in it and I want to now help other people with it.
Sexy Alex from Miami says you can come to my home, mi casa, tu casa. In
I would
Miami.
love to. Thank you. All right, you guys, we'll come back when we do the active. Stay tuned. You want to do, does it matter what laser you do on yours? Do you want to do the deep one or the superficial one?
Me?
Yeah.
What's the difference?